You said that the PCN DES hasn't really helped enable neighbourhood working. Why do you think that is?
So I think the repurposing of the capacity and access improvement funding, that gave us some flexibility to think about how we delivered access perhaps in a more innovative way. But I think that the retraction of funding from primary care networks, and alongside the contractual requirements around urgent on the day, has forced us into thinking much more inwardly around how do we now meet those contractual requirements, because we're not confident about GPs actually seeing that capacity and access funding, because it's so unclear how that's going to be claimed. It doesn't appear to be recurrently funded. It's forcing us into that thinking about how do we create sustainable general practice with the potential loss of funding, because I don't think we're confident yet that we are going to see that maintained into general practice.
Yeah, I suppose that's always going to end up taking priority, isn't it, for the GPs? If their practice is at risk, I mean, and they're worried about money and stuff, that's always going to be their priority rather than the bigger things outside.
And it's ultimately my priority as a PCN manager is sustainable general practice in South Sefton. You know, I am totally committed to partnership and system working, as are my colleagues, but none of that will exist if we don't have sustainable general practice in South Sefton. And I think the whole contract, this whole focus on urgent, and it goes throughout NHS policy around urgent and elective recovery, it is the polar opposite to the intention of neighbourhood health around proactive care that is likely to see outcomes over a longer term. You know, neighbourhood health doesn't deal with the today, and the general practice contract is mandated you deal with the today.